Welcome to my channel again. Today I'm going to talk about cerebral palsy. What are the causes of cerebral palsy? It can be as a result of microcephalic or unusual smaller size of baby head, or macrocephalic, unusual large head of the newborn. It can be as a result of infection such as meningitis, that any infection that can cause the brain blood barrier to get to the baby. It can be as a result of congenital malformation due to disruption in the fetal brain development. It can also occur as a result of premature birth. During premature birth, the skull of the baby's head is so fragile that repeated compression of the baby's head against the mother pelvis during labor can actually cause the damage to the baby's skull and the brain, which can result into an injury that can later affect the baby, like cerebral palsy. Genetic issues can also affect fetal development. Recently, there have been research that links cerebral palsy to biological makeup of a child. Another thing that can result in CP is lack of blood flow or oxygen to the fetus during labor. This can be as a result of prolonged labor or difficult labor, that the baby is not receiving enough oxygen. And I think these actually depend on the healthcare provider attending to the mothers during labor. Another thing is as a result of jaundice. This is a build-up of toxic substance like bilirubin. A higher than normal bilirubin level can actually result into damage to the baby brain, which can cause cerebral palsy. Meconium aspiration is also another thing. Meconium is a stool that the baby passes during few days of life, and this stool is like a gum that when the baby swallow it and stick to the lungs of the newborn, it can cause asphyxia, that the baby will not receive enough oxygen, which can cause shortage of oxygen to the brain. So it can actually result into complications such as cerebral palsy. Newborn hypoglycemic can also cause CP. So for a child born to a diabetic mother, we should be watchful and careful of checking the glucose level after birth. Another risk for cerebral palsy is hydrocephalus. This is abnormal accumulation of fluid in the brain. Conditions affecting pregnancy such as preeclampsia can also be a risk factor to CP. Infection affecting the placenta or amniotic fluid can also cause cerebral palsy. What are the signs that occurs with baby with cerebral palsy? Which are body stiffness, delay in developmental milestone, what the baby should have been able to do at their age, they will not be able to meet up, like the baby will not be able to support their own head. At age 4 months, the baby should have been able to support their head when lying down. Another thing is that they will be irritable more frequently. They will lack interaction. As the age of the babies increases, they're supposed to be able to socialize with their environment. In a baby with CP, they will not be able to. It is important to make this diagnosis as earlier as possible so that the child will be supported and given all the help that will be needed to live a fulfilling life. Likewise, the parent has to be supported because it can be confusing in the initial stage of the diagnosis. So they need all the help, support they can get. I've come to the end of this video. Thank you for watching my video.